We specialise in helping our patients organise multiple plastic surgery procedures. Hi everyone, it's Sarah from International Rejuvenation, and so I'm going to talk a little bit about why we specialise in arranging multiple plastic surgery procedures for our patients. A lot of our patients that go overseas have had massive weight loss and need multiple procedures. So for males it's normally a breast reduction, also known as gynomastia, with a tummy tuck, an arm lift, thigh lift. When it comes to women, it's normally a breast lift or a breast lift with an implant, tummy tuck, arm lift, thigh lift. And then there's also the patients that are just going over and would like multiple procedures. For instance, they may want facial surgery, whether or not it be a facelift or rhinoplasty, along with liposuction, tummy tuck, things like that. So for most procedures, there's a set price, and that's what it will always be. But when it comes to things, for example, an arm lift and a thigh lift, there's no exact price, there's more of a range. The reason why there's no exact price is no arm lift or thigh lift is exactly the same, because it depends on the amount of weight the patient has lost and how much sag they have, on how long the incision needs to be and how much work's involved. So that's the reason why arm lift and thigh lift really don't have a set price. That's why it's more of a range. Before you go over, your surgeon will normally recommend, you know, a certain amount of time you need. And if you're just having one procedure, it's simple. It's going to be, you know, 7, 10 or 14 nights. But when it comes down to having multiple procedures, if they're going to be long procedures, your surgeon will want to split those up over multiple different days. The surgeon always wants the best health outcome for their patient, and they won't want you under anesthesia for long periods of time. So that's why they'll split your different procedures up over different days. So for instance, you may be going and having a facelift. That would be one day, and then another day you might be going in for a abdominoplasty or a tummy tuck. They won't do those together because they are too long, and they don't want you under anesthesia for that longer period of time. The days in between vary, of course, on your surgeon, how long they would like you to have between, so you recover from your anesthesia and are feeling up to it before you go back under anesthesia for your next lot of surgeries. Or sometimes it will depend on your recovery when you're in Thailand. So your surgeon may think you need 3 or 4 days between, but when you're over there he may see that, you know, your recovery is a little bit slower than he'd like, and he may want to push that back. So as much as we always try and give our patients a set time that is recommended in Thailand, when it comes to multiple procedures, it's not always that simple. My best advice is always stay a little bit longer. When you're having multiple procedures than recommended, you can always choose to come home early rather than trying to push your flight back. I hope you found this video helpful. Don't forget to like our video, subscribe to our channel, and follow us on Facebook for social media. Thanks for watching. Bye.